When it comes to a yeast infection or Candida vaginitis, this is simply an overgrowth of yeast in the vagina. Typical symptoms that you would see includes itching and burning, typically of the vulva. The vulva is the outside of the vagina. The burning can worsen with urination. There may also be a whitish, lumpy, odorless vaginal discharge. Most people with a yeast infection will typically have some of these symptoms. Now, there are also certain things that trigger these yeast infections. Number one, use of antibiotics. Typically, if you've been on antibiotics for some time, the antibiotics can actually kill some of the bacteria in the vagina, giving more room for the yeast or the fungus to grow, and hence developing all these symptoms we just talked about. Number two, hormonal changes. When you're pregnant or when you hit menopause or you're breastfeeding, the changes in your hormones actually affect the growth of bacteria and the yeast in your vagina, hence increasing your risk of a yeast infection. Number three, diabetes. If you're a female and you're diabetic, there is also an increased chance of recurring yeast infection because of the changes in the vaginal flora from the extensive accumulation of sugar or glucose in the vagina.